Updated stats on confirmed corona cases as of last night. New daily cases in the U.S., 33,344 with 294 new deaths. Total cases in the United States, 7 million with more than 204,000 deaths and more than 4.2 million who have now recovered. And total cases worldwide, 31.2 million with more than 965,000 deaths and more than 22.8 million people who've beaten the virus globally. That leads us right into our guest. He's with us 3 days a week, Dr. Kavanagh, a retired physician and also founder of a national organization called Health Watch USA. Dr. K, good morning.
Good morning, sir.
Tell us what Health Watch USA is all about.
Well, we're a nonprofit organization that centers on patient advocacy and healthcare policy. And over the past decade, we've really concentrated our efforts on infectious disease. And we've published in a number of peer-reviewed journals along with holding conferences. And we are a national organization.
I saved this story for you because I wanted to see the top of your head come off. A bar in Florida now requiring people not to wear masks. The owner says, quote, "We do not support them. We do not believe in them." So that was your head coming off.
Yes, I mean, it's disappointing. You gave the statistics for the United States of our deaths and cases. If you were to look at South Korea, they have only had 380 deaths. And if you adjusted that for population and they were as big as the United States, they would have under 3,000 deaths. So we are not doing well, and we're not doing well because the public has not bought into and has not followed public health advice. And this is just one example of it. We really do need to take this virus seriously.
It's become a political football.
Well, it has, and people are debating whether you have a constitutional right to mandate masks, not mandate masks. We're not going to wear a mask because of this candidate or wear one because of that candidate, and it's very distressing. I know nothing about the law. I can't tell you about the constitutional rights of whether or not you can wear a mask. I can tell you the virus has the right to both kill you and your family and loved ones if you don't. So please wear a mask.
What is South Korea doing that we're not doing?
Well, the main thing is testing. They started testing early on. Culturally, they're not adverse to wearing masks, and they really respect one another's rights. You know, in the United States, we're more concerned about individual rights instead of the rights of the society and the well-being of other people. But the main thing South Korea did was testing, testing, and testing. And of course, I've advocated for that repeatedly on this program.
All right. What else is new this morning, sir?
Well, the two biggest things is that, one, the CDC has reversed their stance on testing. As you know, they're now advocating for testing for asymptomatic carriers and community spread. And this is something that our group has advocated for a long time now. But the other really big thing is that the CDC now recognizes that this virus is highly infectious and is airborne. That's the terminology they used, with asymptomatic spread. That's kind of like in the movie Outbreak, if you remember, where Dustin Hoffman said, "Oh, my God, it's airborne." So this is what we're dealing with, and we really do need to act accordingly. For a long time on this program, have advocated for N95 masks, but most importantly, good air quality and airflow inside, and that includes in schools. Over the past 6 months, I am very hopeful that the schools have upgraded their heating and air conditioning system so that you have good airflow, good quality. That air should turn over at least once every 10 minutes in a school. And that's without a pandemic. In a pandemic, hopefully sooner. And this is something they need to be doing on the front end, and they need to make sure that that air is safe and being sterilized. We advocated for this on a radio station up in Boston, and this was back in July. Governor Dukakis was on the show at that time, and I don't think anybody listened, and now the big headlines in the Boston Globe is the big hang up on opening schools is the poor air quality. They have buildings where the windows don't even open. So this is something we really do need to look at and make sure that our children are safe. Safe means wearing masks, social distancing, and doing both, not one or the other, good airflow and air quality in our schools, and making sure that we're using testing in a very smart fashion in schools. We can test our athletes. We should be able to test our children in schools and keep them safe.
Always a pleasure, sir. Dr. Kevin Kavanagh. We'll talk to you on Wednesday.
Okay, thank you, Jack.